Today we are going to go over the order of draw for the Vacutainer tubes when you're going to perform a venipuncture on a patient. The first tube in the order of draw is going to be either your blood culture bottles or the light yellow Vacutainer tube here. The additive for these two bottles and Vacutainer tube is either culture media, which is in the bottom of the culture bottles. They come in a set, and one is going to be for aerobic bacteria and one's going to be for anaerobic bacteria. The light yellow tube contains SPS in it, and what we're looking for when we draw either the bottles or that light yellow tube, we're doing blood cultures, so they're looking for either septicemia or bacteremia in the blood. Generally with patients that have a fever of unknown origin, those are patients that we definitely will run these tests on to try to figure out what's going on with them that we can't figure out any other way that we've tried so far. That test is an aseptic procedure, so it is done separately but still before any other blood draws, and you're going to clean the area and set that up just almost like a minor procedure. So we're going to go a little bit beyond just regular alcohol, and that's something we can show you later on. Your next tube in your order of draw is going to be your light blue tube. That tube has sodium citrate in it. I say that if you can remember that light rhymes with sight, so light rhymes with sight, you can remember that the additive for light blue is sodium citrate. In that tube, we're going to be drawing coagulation studies. Examples of that are going to be your ProTime, which is abbreviated PT or PTINR, partial thrombin time, which is abbreviated PTT, fibrin, fibrinogen, fibrin degradation products, and also D-dimers go into the light blue tube. There are more. The way I remember this one is that if it ends in the word time, or if it looks like fiber, like a piece of cloth or clothing, it goes into the light blue tube. Those tests are looking at how thick or thin the blood is and how fast our blood clots. So those are all parts of our clotting system. All right, next we have our red top tube. That tube does not have a chemical additive in it, so the blood in that tube is going to clot. Sometimes they put a chemical additive in there to make the blood clot faster, but otherwise there's no chemical that's going to prevent the blood from clotting. Tests that go in there, one, we first have either blood banking testing, so if we're going to donate blood or for transfusion or to donate to someone else, we have your ABO blood typing, your RH typing, and cross match. For example, some facilities are going to either use the red tube that I just showed you, or they may use this light pink EDTA tube that they'll only use for blood banking. So there are options with that. Other tests that go into the red tube, there's mononucleosis testing, which is generally called a monospot, pregnancy tests, when you're looking for syphilis, which is usually your RPR, CRP, which is a C-reactive protein, cold agglutins, and then other serology and chemistry testing can go into that tube. The next tube that I show you, your gold or your serum separator tube, are similar and interchangeable. If you were out of one, you could use the other. So I always say if you don't have one, you can go with the other on exam questions and generally in the office setting too. One other thing that goes into the red top tube is going to be your therapeutic drug monitoring. So people that we have to monitor their medicine levels, those tests go in there also. Next, you have your serum separator tube. They can either be gold like you have here, or they can be either marble or tiger top like you see here. Big thing that leads to it being an SST tube is it's going to have this wax gel barrier at the bottom that once we centrifuge it in the machine, it's going to push that up and separate the serum of your blood and the blood cells and clotting factors in the bottom. So if it has this barrier and it has a gold or tiger top, it's going to be your serum separator tube, which we abbreviate SST. So again, there's no chemical additive. The blood will clot in this tube, but it's going to have that barrier at the bottom. For that, your chemistry and your serology testing also go into this. Big things that we run often are going to be your cholesterol testing, complete metabolic panel and a basic metabolic panel looking at your kidney and liver functions, vitamins, minerals, antibody titer testing, and hormones. So also when you're looking to study these, if you can get down all of the other tubes except for pretty much the red and the gold, you can assume that if it didn't go into the one of the other ones that you've gotten down, it'll probably go into one of these. All right, next you have your green top tube. That tube either is going to have lithium, ammonia, or sodium heparin in it as an additive. Really, if you can just remember, heparin is the additive for these. That's your main information you need to know. Some of your green top tubes are called plasma separator tubes, which means it's going to separate the plasma out from the blood cells, and it also has that gel barrier in the bottom of it for centrifuging. But again, they're all going to have one of those types of heparin in them. For that, main things you want to remember is going to be that we usually are going to see stat chemistry testing going into that tube. So in an ER setting or in a facility where they're able to do stat tests, meaning that they need to be done immediately, those testing would go into this tube. So stat electrolytes or stat CMP that we talked about a couple minutes ago, all of those would go into there. And then we also look for cardiac damage markers. An example of that is troponin. Those are run if we think someone may be having a heart attack. So obviously that would still fall under stat testing because we want to get that done quickly. All right, next we have your purple or lavender top tube. They can either be a darker top or a lavender. Additive is going to be EDTA for that. And the tests that go in there are going to be your hematology tests. So hematology is looking at your blood cells. So examples are a complete blood cell count, which is a CBC, white blood cells, red blood cells, platelet counts, a hemoglobin A1C, or an erythrocyte sedimentation rate, which we abbreviate ESR or SED rate, and lastly hemoglobin and hematocrits. There's a lot of tests that go into the lavender tube. So I say if it has the word cell in it, if it has the suffix site, if it has the word count, or if it has the prefix heme, you put in the lavender tube. All right, lastly, you have your gray top tube. Here's some examples of those because they can vary a little bit. There are two additives in a gray tube, so this is the only one you have to worry about learning two. That's sodium fluoride and potassium oxalate. In this tube, you're going to put all your glucose testing in there. So if you have to do a fasting blood sugar, random glucose, your glucose tolerance testing, which is done to help see if someone is diabetic, and it's also done on pregnant women. And then also you have your blood alcohol testing. I always say if you can remember beer and wine has a ton of sugar in it, then you can remember that those tests go together. And then lastly, we also put a lactate test in there, and that one has to be kept cold after it is drawn from a person. One thing I can remind you of too, because people get confused, is that insulin does not go into a gray top tube. it's going to go into your gold tube, your SST tube. Remember, insulin is a hormone. It's not part of blood sugar. And so from there, we're going to look at a requisition of our patient that we're about to draw blood on. Lab requisitions can come in all different styles. This is one we just made up real quick. So you have your patient's information that you'll want to check when you bring your patient back and verify that the person that you have is the person you're about to draw blood on. Next, they have generally their insurance information. They're going to have information about the facility that you work at. They're usually going to have an area where you need to mark whether that patient is fasting or if the patient is not fasting. So you're going to need to ask the patient that question. And then lastly, they're going to have some tests that vary in how many will be on the requisition, but what you're looking for is what you have to draw on your patient. So Mr. Bernard here needs to have a complete metabolic panel, a fasting lipid panel, a complete blood count, and a glucose, fasting glucose drawn on him today. It's always going to need to be time and dated when you draw the blood, and you should always make sure that the physician's signature and name are on the requisition to make sure that it is official and you're able to draw the blood on the patient. So we will go ahead and get our patient called back, and then we will get our tubes and everything that we need. And I'm going to take those to the board. I need to grab them. Alright, I need a lavender tube. Which I put it on. I need it. Okay, let's get an SST tube. Is that for running? Oh. Alright, so I need an SST tube, a gray tube, and a lavender tube. That one. Alright, so you have your patient come back. I'm going to call them back, and you want to verify their name, which is, may I have your first and last name, please?
Yes, it's Kerry, Kerry, last name Barnard.
Great. Do you know your patient ID number?
Yes, patient ID number is 2809.
Great. If you don't have a patient ID number, also there's usually a place to have the social security number. That may be what you get from the patient for verification, the last four of their social. And then also you want to ask them their date of birth, which is
04/20/1971.
Great. And then you want to check your requisition again, make sure that you get the right tube. So when we're looking at that, we have a complete metabolic panel. That one is going to go into your gold tube. You have a lipid panel, which is also going to go into your gold tube, a complete blood count, which we'll put into our lavender tube, and then a fasting glucose, which will go into our gray tube. So next thing you want to do is get all of your supplies together and go wash your hands. Then you want to find the vein that we're going to use on our patient. So, let's see, we're going to go.
That's okay.
So we're going to go. Alright, take your tourniquet off. And you then want to clean the area that you're going to be drawing blood with an alcohol prep pad. Okay. And while that's drying, you can go ahead and set up your needle. So you'll take, if you're doing a straight venipuncture needle, you'll take the back off of your needle and screw it into your holder. You want to make sure that everything is on your non-dominant side so that you don't have to reach across the patient. And you also want to make sure that your bandage or whatever you're going to use to cover up the area afterwards is open so you can get to it quickly. And then you want to make sure that your tubes are in right order. So going back to our chart that we were talking about, we have your gold tube, then your lavender tube, and then your gray tube. By the time you get that set up and you get your gloves, and put those on. Your patient's arm should be dry, and you can go ahead and reapply your tourniquet and perform your venipuncture. Alright, so apply your tourniquet again. Remember that needs to be 3 to 4 inches up the middle of the arm so it doesn't get into the way of your venipuncture site. Go ahead and grab your needle, and you want to anchor your vein and follow the vein in whichever way that the vein is positioned at. Go ahead and put your first tube in. You want to use the little wings on the side of the holder to help you push the tube in. Once that tube is filled, go ahead and pick up your next tube and put that one in. Let that one fill all the way up. And then your last tube. When you get to your last tube, that's when I would take your tourniquet off, because remember, it only needs to be on for a minute. Take your tube out and go ahead and grab your gauze, place that over the needle, and then pull your needle straight out, and that will go into your sharps container. You can have the patient hold pressure, and then we'll go ahead and apply the bandage. Okay. As long as your patient has done bleeding and the blood is clotting and he feels okay, he's then able to go on his way for the day. Alright, so in review, remember that we just drew a complete metabolic panel, a lipid panel, a complete blood count, and a glucose. So back to our board, that means that we would need the gold top tube that we drew for the cholesterol, for the lipid panel, and the CMP. If you notice on the board when we were going over these, there are different size tubes available depending on how many tests you're drawing. Your short tube usually can have between 2 to 3 tests, and then the larger tube can be 2 to 4 tests. I always get more blood than less blood to make sure I have enough for the lab to be able to process. So we had those two. Next you had your lavender tube, which was going to be for your complete blood count for your hematology test. And then lastly, your gray tube for your fasting glucose.